Let's head into the KUAM News Zoom room where we have standing by. She's the director of the Office of Homeless Assistance, Sarah Thomas Nededog. Good morning, Sarah. Unmute.
Buena. Hey, Chris, Jason, Sabrina. Good
Hi.
to
Who is the young man with you there?
Hey, I want to introduce my senior social work student from the University of Guam. He's been like a godsend to me as we're starting the OHAP office. His name is Arthur Paulino. Arthur, you want to say hi to everyone?
Of course. Hi everyone. Buenas and Hafiday. My name is Arthur Paulino, and like what Miss Nededog told you guys, I am the first senior social work student at the University of Guam, helping her out.
Nice.
Yeah, I'm gonna graduate in May, so we'll have another full-fledged social worker on the ground, and his experience with yeah, is that awesome?
Yeah.
His experience with the homeless program folks and the homeless themselves is a great experience for him. So we're happy that we're able to work something out with the University of Guam social work program. But thank you for having us this morning. Always.
Yeah.
I always appreciate connecting with you all. Hope everything is good with you and all's well.
I want to ask Arthur though, what's it like to go from the classroom setting where you're learning about a lot of these things that are actually happening in real life, right, on the island? So when you go from the classroom and you come out and you help Sarah with the Office of Homeless Assistance, what are you seeing out there, and how great is the need for services and just the need in general for the homeless population on this island?
Right. So far, based on my experience, really, the difference between learning things in the classroom versus experiencing the poverty and the homelessness in person is two different things. And I'm so happy to experience everything that I get to experience with OHAP, because I'm not going to lie, experiencing the homelessness and the poverty, it takes a lot. It takes a lot of emotions and a lot of understanding to see how can we help further help these people and this population. And so far for me, really, our ideal goal for OHAP with Ms. Sarah is how can we help these people from their temporary shelters to give them permanent housing, permanent homes, help them to get back on their feet. And so far, I'm seeing how, as a social work student, so hard because, not everyone wants to change. Not everyone wants your help. And so, lately, we've come across some people in the homeless shelters, like global dorms, where, they like where they're at so far. They like the help that they're being given. And, they were sharing to us about some things that they want further help with, And so all I can say really is that I believe every social work student and probably every social worker needs to experience working with the homelessness at least once in a lifetime, not just to appreciate life, but to really see that on Guam, homelessness is a big thing, and that we really need to do something to help increase, help their life to get better. And that's why with OHAP, I'm happy to be part of that change, hopefully, And so yes, from the books to applying it now in real life, they're two separate things. But all I can say really is so far with the homelessness, all it takes is to be open, to say, yes, I want to make a difference in this population and I'm going to do it. For me, I'm happy that I'm open to this population to help serve them.
What got you interested in this particular line of work?
So for me in general, really, I just want to take care of people. And as I got into the social work program, getting more into the teachings of it, I realized that I want to be an advocate to the marginalized communities and populations, such as, for me, the inmate population was one of them, homelessness. So I want to be a part of a change that not everyone is either comfortable to work with or not everyone is willing to do. Because, in social work so far, the popular fields to get into is mental health, victim advocates, but not everyone talks about homelessness. Not everyone talks about the marginalized group. And I want to be that voice, and not just a voice, but I want to be that action to help these individuals and families get back to their life. And if they don't want the help, then I just want to let them know that there's someone like me who's willing to help them, you know?
Right, yeah.
Well, that's good to hear because
Yeah.
some people, might be, in your position and where, they're going to work and look at the homeless situation and might be, um, scared, like I
Yeah.
don't think this is not what I wanted to get into.
Yeah.
But for you, it sounds like it has just fueled your passion
Yeah.
uh,
Very, very
to work
Christ-like,
even harder.
Arthur, to want to get down in the dregs of society and to make, and to me, that's kind of the root of social work, right? Is that you got to go to these places that, people just don't want to go to. And we talk about homelessness here on this show and on this station. I want to say that we were some of the first media, if not the first, to go out here and to interview these people standing on the intersections to kind of share their stories with people. But you know what I really fear, Sarah and Arthur? I fear that our people, in so many ways, we just get used to things. And I feel like right now, people have just gotten used to the fact that there's people right out here asking for money. There's like 4 people out on the street corner, different sides, different signs, and you see it at every intersection on the island. And I feel like a lot of our people have just got complacent and said, "Oh, it's just the way it is." Okay, and we don't even see them anymore, right? So we raise the visibility, but I just really don't want them to become invisible again. So how do we as a community kind of avoid that from happening, or keep that from happening?
You too. I just thank you for that conversation you just had with Arthur. I appreciate his sharing and your understanding and receptiveness to what he just said. So I think first and foremost, that sensitivity that the media has, that our community has, is really going to be important. So I just thank you. Just stay with us, stay with this issue of homelessness, because it's really going to be a concerted effort from the private business, from the nonprofits and the governmental entities to come together, and our general community members. And there are also people who are formerly homeless who provide consultation as well. So we have the Guam Homeless Coalition that is chaired by Samantha Taitano from Manetlu, and the Interagency Council on Homelessness that's chaired by our governor. So these 2 entities bring together all the providers and consumers, and again, governmental and nonprofit organizations. And OHAP's role in all of this is to be that coordinative entity that keeps everyone together, that brings everyone together and highlights the issues that we need to work on. For example, what policies or laws can we strengthen? What are some of the service provider priorities that we want to push? I so appreciate when you said that people are so used to seeing those that are out there on the streets, and that's called desensitization, right?
Mm-hmm.
People become desensitized because they see it all the time. And you're absolutely right. That's something we don't want to see. We don't want to see that people think it's okay and it's all right and it's not my problem. The other day, I had an awesome experience. I was at Global Dorms, where the emergency shelter is for those who are homeless. And there's a lot to be desired with that program, but the best thing about it is it brings people off the streets who could be exposed to all kinds of things, even more so now with the pandemic. So the idea is to bring them into a safe, healthy environment so that they don't have additional exposures to the pandemic, because being homeless and on the street, as you all know, already means they're exposed to communicable diseases, even non-communicable diseases, because if they're not being treated for high blood pressure or diabetes, then that can be exacerbated right from being out on the streets. But also they're subject to violence, and we hear this so often with persons that are coming in who are homeless, that they have been robbed, they've been assaulted, things have happened to them that are not good, and especially when they have children. I mean, it's just heart wrenching to see that we have children that are out there. So I believe that, you know, the way forward is for that level of concern and interest for our community, for our children, for our families who are homeless, that stop. When I was at Global the other day, I started to say, I ran into an old friend of mine, and she picked up a woman and her young daughter, and she fed them. She got them what they needed, you know, showers and all of that. And then she brought them to Global dorms. But, you know, I just thanked her profusely for taking time out to do that, you know. And oftentimes people find themselves homeless. They call it situational homelessness. And that's when you get evicted because you can't pay rent,
Right.
or you have a breakup with a partner and, you know, you're out in the streets. Those are situational. But of course, the issues of poverty are always going to be foremost. People just can't afford to pay for rent and to be able to take care of a household. And that's one. And then, of course, there are folks that have untreated behavioral health issues. They might have drug and alcohol issues as well. And sadly, there are folks who also are dislocated or disconnected from their families and their support system and from their communities. So dealing with those are, you know, the first line is to get them into a safe environment, right? And then the second is to identify if they have any health issues, behavioral health or physical health issues that need to be addressed immediately. And then taking a look at what resources, like when I say resources, I'm basically talking about friends and relatives that might be willing to help support them in coming back to the home, to the family home, or back into the community. So finding those connections, because that support system is what's going to sustain them, their family, their friends, and their community. So we have a significant number of local people. I think it's over at Global Dorms. There's 100 and some people there, and
The capacity, right?
Pardon?
It's at capacity.
Yeah,
Yeah.
there's 100 and some there now, and 100 and some people, and about 50 of them are adults and 60 of them are children.
Wow.
And about it's almost half and half that are Chamorros, people from Guam and from the Marianas. And then the other populations are those from our neighboring islands or from the continental United States. So we have a diversity, I suppose, of people, but getting them reconnected to their families and their communities and giving them a way forward, because some of them are not eligible for programming for, you know, federal and both basically a lot of the federal programs.
Because
they
of
may not be for. So
because of
we
what?
have to
Like convictions or something, Sarah?
Yeah, sometimes that's what it is. Because if you've been convicted of a crime, you're not eligible to be in federal housing.
Let me ask you this, because this is something that I hear a lot whenever I talk about the homelessness with people. Is you mentioned people from the continental United States, right? I mean, Guam is such a small community. We pretty much know everybody. Like some of these homeless people that I see, like I know their family, right? They fall out of their family for whatever reason, issues that they got going on. Family doesn't want them around. They got to hit the streets. But what about these people you see who are obviously not from Guam, they end up on the island and they're just like fresh off the plane homeless. Like what,
Yeah.
how do they come here? And is there any truth to this idea that people talk about where you have them and they break the law in some place in, you know, whatever town, any town, USA, and they're like, oh, one-way ticket to Guam. Is that actually what happens, or how do some of these like continental U.S. homeless, how do they end up coming on Guam, and how do they end up becoming homeless?
Okay, so I have in my 40 years of work, I have run across folks who have told me that they were given a one-way ticket from someone, some state or some entity working with them to send them, you know, to Guam, or sometimes send them to Hawaii. And the idea, from what I understand, is that they're being sent to a place where the weather is good, especially around winter time. There's so many homeless people who die or who are at great risk of death because they do not have adequate shelter and clothing to survive the harsh weather conditions. So there have been a couple of people that have shared that with me over the years, but there are other people who will buy themselves a one-way ticket to an island like Guam or Hawaii. And as you know, there are literally thousands of homeless people in Ayala Park and in at the beaches as well, right? So we do see that. And why they do that, from again, is because the weather is kinder to them,
right?
And it's harsh as the weather that they see. And they also, I believe, they hear about the generosity of the people here on island. And so that's a good thing. I do want to say, though, that there are some people who have money, but they do not want to, they don't want to be restricted or obligated to run a household, have their own apartment and pay rent and pay water and power and et cetera. And I have run across situations like that, individuals that feel very strongly about that. And I'm going to go back to some of the causal factors. Some of the reasons why people are homeless is because they might have an untreated behavioral health issue, or substance abuse issue. And then again, not being connected to their families and their friends, to be with them and to give them feedback about, this can happen, we'll support you, come on in. And going to treatment is scary.
Right.
And, we have...
Sarah actually had a caller on who has a question kind of about that. We're going to bring on Colleen. Colleen, welcome to the link. You're on with Sarah Thomas Nededog, who's the director of the Office of Homeless Assistance. Go ahead. Good morning.
Hi, good morning, Ms. Nededog. I had a question regarding the global housing. So I wanted to know, you mentioned that global housing provides a housing for the homeless to get off the streets. Does this also provide them with the resources to get back on their feet? And for those who actually have health issues and medical issues, and for those who have children, the resources to get back on their daily lives and by getting off the street?
Sarah?
I'm sorry. I'm sorry. Can you guys repeat?
She was asking that, you guys provide a housing placement for these homeless families, right? And then when you do provide housing for them, do you also provide those continued wraparound services to get them off their feet with, job placement, helping their children with, education, with their health issues, things like that?
Exactly. So Catholic Social Services has the current contract with the government of Guam to provide those programmatic and supportive services for persons that come into the global dorms or they're identified as being homeless on the street. So that's exactly what they do, the health screening, the evaluation to see what programs they need to be in to get the kids back into school if they're not in school. There's a lot of kids that are preschool age there, but they certainly have school age kids. So making sure that they're, you know, that they're attending school. And they actually took with the Guam Bar Association, I have to do a shout out to Jay Areola and the Bar Association, because during the holidays, they brought in several computers, and there was one of the rooms was converted into a learning center just for that reason, to get the kids to come in and do their homework and their searches and their participation on the computer so that they can maintain their participation. And it's also where the adults can do job searches or do any kind of research that they need to get back on the back into society and in employment and education. And there are social workers there that help facilitate that. So that's it's a good thing that they're being brought in and they're being dealt with family by family, individuals together, because otherwise it would be really hard to find them on the streets. Although we do know some places where folks are living, and we're hoping that in the next couple of months, as we get our budget and our OHAP together, we're going to do even more outreach.
Mm-hmm.
And
Do you guys
I think we
have any numbers in terms of how many families you guys have been able to place into homes, went from homeless to with a home?
How can I ask?
Oh,
First of
okay.
all,
We
Sorry,
still have
Sarah.
somebody-
Hi, Colleen.
Hi, I'm sorry. Can I just ask another question?
Sure.
So, how long does this program normally last for? Like, is this an extension for like a year, or do they have a limited time of how long it'll take them to get on their feet?
Good point. Colleen, do you know of an instance or something? Because if you do, just tell us and we'll
No, I'm a big part of Simple Hearts Association, which is also a nonprofit.
Okay.
But we also did a homeless drive several times, and I've had many conversations with homeless women in general, and some who brought children and families. And I'm not gonna lie, it does break your heart, because at any given time, this could be me, you, or anybody we know, and it's heartbreaking. And I've had a conversation with a lady, and she asked me, Nan, can I have this blanket? And I said, you're more than welcome. And she said, because I live in the jungle. And it broke me, because you want to give and you want to help, but you have no idea how to. So is there, there's a bunch of businesses, big businesses on Guam. Have anyone, or has there been ever like a proposal plan in bringing up not just a dorm like the global dorms, but something bigger for where they also can house it separately? So I mean, I'm not too sure if the global dorms is separate for families and women, and then separate from men.
Right.
Yeah,
protection wise.
and
Colleen,
I'm
we're
glad.
going to let Sarah go ahead and answer, so I'm going to go ahead and let you go.
Yeah, first I just wanted to point out, because I'm glad Colleen brought that up, because this whole global dorms situation, it was only for under the declaration of the public health emergency.
Right.
And we're already almost a year into this. What is the long-term plan? Is there any discussions with like Colleen was saying, with the private sector, or just in general, what are we going to do when the governor lifts this public health emergency and there is no more global dorms?
Mm-hmm. Let me just share that there, in a community ideally there's a continuum of services. So there's an emergency shelter always. There's always going to be people that are going to require an emergency shelter. They should never be there for a long time. They should be there for a period where you can do screenings and evaluations and make sure that they're referred to the proper entities. So that's the mechanism that we're looking at right now. That's what we're looking at, is how can we speed that up? How can we make sure that's really tight so when they come in, when they present, we can rule out some of the things that might be issues that they need to deal with immediately. That's primarily their physical health or their behavioral health, and make sure that they get those services and then do an evaluation on what other programs and how they can qualify or how they can be in permanent housing. It's always the goal to get folks from being homeless and on the streets to emergency shelter, transitional if necessary, but as soon as possible to permanent housing. So that's what we're unraveling now. That's really the role of OHAP, is to identify what laws and programs, where are the gaps and barriers, and to make sure that we get those addressed in the next 30, 60 days. We're also looking at an outreach center so that people can walk right in. It's like storefront is what we call it in human services, where it's right on the road, easily accessible and visible, where folks can come in and we can identify as soon as possible what's going on with them and how we can connect them or reconnect them with family and with the community so they're off the streets. And we're looking at anywhere, I've heard numbers from 2,000 to possibly 6,000 on Guam right now who are homeless or at risk of homelessness or are living in substandard housing. That's I can't tell you how many cases I've already seen where people are just living anywhere, shacks and just places that are not meant for habitation.
Right. We have another call here, Sarah, so we're going to bring up,
okay.
I didn't get your name, sir. Hello? Welcome to the link.
Yes.
Good morning.
Good morning. My name is Anthony Guillermo. I'm very knowledgeable about the homeless. I'm a Salvation Army volunteer. May I ask Sarah, where is her office located, her contact number, or her email address? Because I was able to know the situations of homeless individuals or families in 20 categories on why they became homeless, because I've been interviewing them for the past several months.
Right, so you just need Sarah's contact info? Right on. Anthony, thank you.
There's another thing.
Okay.
Can I air something else? March 17 is National Social Workers Day. I'm coordinating a waving support that day across the IDC building and opposite corner right in front of Coast 360 in Tamuning.
Oh, there you go. Sarah, did you know it's National Social Workers Day, March 17?
Yeah, I'll be there.
Okay.
Yeah, and
Thank you.
I might
Let me just say that
do the waving at the Guam Behavioral Health entrance parking lot.
Got it.
By the way, on the IDC building on the 17th, it will be held. The time will be starting at 7:30 a.m. up to 9 o'clock a.m.
Okay. Anthony, can you email me that information? Sabrina@kuam.com.
Yes, and at the Guam Behavioral Health, probably we'll do that also, maybe in the afternoon.
Okay.
Right on. Thank you, Anthony. Email Sabrina, please. Sabrina@kuam.com. That's SABRINA@kuam.com.
KUAM, say that again?
Yes, KUAM.com.
.com. Okay. All right.
Thanks,
Thank you.
Anthony. Sarah could send you the info too. and his contact as well. Or if you want me to send him your contact information, I could do that.
Okay, we're connected with Teresa Ariola at Guam Behavioral Health. So yeah, no problem. I mean, just let them know that we are in. We just had a meeting last week with them because they're obviously Guam Behavioral Health is a big part of how we're going to address this issue of homelessness on Guam. Them with public health and Department of Labor and several other entities. So thank you for the call.
Right on.
And just let you know, right now our OHAP office, we just were able to move in last week, and we just have a desk and chairs right now, but we're over on the second floor of the Addis building where the mayor's council is downstairs, next to Paradise Gyms. Those two buildings there. There's AM Insurance there, and in fact, Guam Behavioral Health Wellness Center has their program on the corner of downstairs. So we're upstairs in room 203F, F like in Frank. So this is just an administrative office. We're hoping to open an outreach center, as I mentioned earlier, where we're more accessible and visible in the community and to those in need. And we're praying we're able to get something in the next couple of months. Hopefully not more than, let's say, the next 2 months. Getting things through is not as quick as I would like to get things done. But there is a commitment, from the front office to move these programs and services. So that's definitely a plus for us. But we're making our way forward. Give us a call. The best number really to call for services is global. That's Catholic Social Services, Mike Suzuki, Bo Solis. They're just awesome. They're doing their thing down there, and they're really working hard. They're at 477-9234. Sabrina, do you have that?
Yeah.
Okay, great.
Did you? I'm
they
sorry,
can
Sarah,
call.
because I was doing things offline here. Did you talk about the new shelter? So we know we're at capacity. Lieutenant Governor has said that there have been efforts underway to secure another property for another homeless shelter. But he was saying that they're running into issues with these property owners jacking up the price or whatever when they find out it's going to be a homeless shelter. So where are we with securing another facility to house the homeless?
We're not there yet. You got the update from the Lieutenant Governor. The ideal situation is to have smaller shelters in different parts of the island, so it's not far for people to go, so that especially the kids, so they can continue going to the same school. And there aren't, when people start going back to school, of course, right now that might not be as big of an issue, but the ideal situation is having emergency shelters in 3 parts of the island, northern, central, and southern. That's the ideal. So we're looking at that plan and seeing how we can implement it. And it might be smaller, but it'll definitely be more accessible and closer to schools for the children, since we already know that our population has a high number of children. So we want to do that. We want to keep them close to their communities if at all possible.
Sarah, just for clarification, if the governor lifts the public health emergency for Guam on April 1, will people at the global dorms, will they be put back out on the street?
That's a good question, and I'm going to get clarification because there's thinking that because it's funded by the CARES Act, that should not be an obstacle, and it's a technical issue that has to be. Hey, let's revisit this like next week, and I'll give you an update on that, because it is something we're looking at. Is this going to be an issue? And prayerfully it won't be. And there's also, local initiatives that we can figure out if worst comes to worst, right? But we cannot just throw the Mac out in the streets, and we won't. We're going to figure something out. Thank you for the good question, though.
Thank you.
Right
We'll
on.
definitely check back with you.
Yeah.
That was one of my. That's always been in the back
Yeah.
of my head. Wait a minute, what's going to happen?
Right.
You know.
Right. And April 1st is a month from now.
Yeah.
So yeah. There's reasons for having a state of keeping in a public health emergency,
Yeah.
a state of
Yeah.
emergency. It's it provides the resources to come to Guam to understand these costs, but we have to look at alternatives as well, right? When that runs out, because even in the best cases, that money is going to run out at some point. And if we're able to take this opportunity to develop programs that make sense and work for our people, despite the if the pandemic is not an issue or not, we still are going to deal with homelessness and folks who are at risk of poverty, right? So it's a time for us to figure it out as best possible. We have the luxury, so to speak, to have the resources and the people coming together to really think this out. We have some great people putting their minds to it. So I'm hopeful that in the next week or so we're gonna have some answers about next steps.
Right. Well, thanks, Sarah. I know you've been on the ground on these sorts of issues for years, so
Yeah.
it's good to see that you're leading the charge on this.
Right
so thank
on.
you.
Thank you, Sarah.
Thank you.
Okay. Stay safe.
There you go.
Talk to you next week.